epidemic in Cameroon. And recent statistics indicate tuberculosis infections are on the rise in Cameroon. Cameroon's Minister of Public Health has called on Cameroonians to be more vigilant as far as the drugs are concerned. And tension has been high in Dop in the northwest region of Cameroon for 2 days now, following the forced traders open sheds on Goose Town on Mondays. Those were major stories. Details right ahead.
Canal International.
Good evening once more. Tension has been high in Dop, Ngokitinya Division, northwest region of Cameroon for the past 2 days, following the burning of 3 vehicles and the adoption of 3 persons by separatist fighters after the administration began an operation to force traders to open their sheds on Mondays in a bid to counter the weekly Ghost Town on Mondays. More in the following report. Regina Leketadak.
At least 3 vehicles were on Wednesday set on fire in Bamising village in Dop, Ngoketunja division of the Northwest region by suspected separatist fighters. Reports say trouble broke out as a result of a show of strength between the administration and separatist fighters after the administration tried to stop the weekly Monday Ghost Town by compelling traders to open their businesses last Monday and for transport activities to go on. Amongst the 3 vehicles burned is a 4-wheel drive belonging to the UN VDA rice processing parastatal in Dop, since the traffic circulation between Bamenda and Dop and the rest of the ring road stretch to Kumbo in Bui and Kambe in Donga Mountain division has not been possible. Indigents of Donga Mountain have been regretting this latest roadblock barely a few weeks after separatists softened their stance over traffic circulation along the Bamenda and Kambe road after years of inactivity. At the moment, 1,400 teachers in Ngoketunja division have been without salaries for some months now, still as a result of the ongoing arm twisting between the belligerents in the ongoing socio-political crisis.
That was a report by Regina Leketanda, Annie Collins, Anya, correspondent in the Northwest region of Cameroon. Now, lawyers under the Ohada space have come together to review the activities and manner of functionality during the 20 years of existence. One of the key difficulties underlined during the conference in the nation's political capital, Yaoundé, is on balance and nature of the 2 languages. Measures to institute effective use of the English language within the Ohada space, one of the priorities of the colloquium. More on the story with our reporter, Hyson Cha.
Members of the Bar Association in the Ohada space coming together in the nation's political capital to evaluate their work done so far after 20 years of creation. A special assessment on the implementation of the Ohada laws in the troubled regions of Cameroon.
First, we have to check if precedents of CCGA are applied in the Northwest and Southwest jurisdiction. Northwest and Southwest jurisdiction are not out of Cameroon. They are in Cameroon. So they have to see what is done in Abidjan, and they have to make the judgment conforms with the judgment of the CCGA.
According to some lawyers, there are a lot of challenges faced during their working sessions, especially language barriers. It is therefore important of seeking solutions to bridge the language gaps.
Some of our colleagues were disappointed because of the use of the French in the colloquium. But as I say in my speech, the conference is looking for organize specific training for English-speaking lawyers, maybe this year, or if it's not the year, maybe next year. It will be very good next year because we will be on the 30th anniversary of the OHADA, and I think we will have obligation to organize our seminars in several languages.
The 3 days colloquium bringing together members of OHADA from the 17 bar associations of different African countries. This March 23rd is a forum to review the functionality, identify errors committed within its jurisdiction, and adopt efficient amendments.
With over 400 cases and 40 deaths registered thus far, cholera is now an epidemic in Cameroon in a bid to help the population of not only Afako division in the southwest region of Cameroon, but the rest of the country as well. Government has put in place a surveillance system to handle the situation on the ground. More on that story with our reporter Udmu Kusumi.
Some of the measures in place include epistemological surveillance activities, community-based surveillance, and active case founding on the initial cholera outbreak. Epistemological investigations are going on in the southwest, littoral, and the central regions. Both health districts in Nigeria are high-risk areas in collaboration with health structures, strengthening surveillance activities in the communities, district, and even in border zones. Response are already in place, such as free vaccination campaign launched in the southwest to be extended to other health districts of the region. This spot is an additional public message for the affected and non-affected population.
There is cholera in our communities. It begins with diarrhea, vomiting, thirst, fatigue, and nausea. If you or someone you know has these symptoms, go immediately to the nearest
health officials are calling on Cameroonians to respect the measures put in place to avoid contamination and quickly rush suspected cases.
And in the Mongo division here in the littoral region, hospitals are already jammed full with patients suffering from cholera. Medics see though treatment remains costly, they are lacking in terms of budgetary equipment and infrastructure. In the meantime, a research team of medical experts have been on the field to get samples of water in a running river in the Mongo division for research analysis. More in the following story.
With their test tubes, these health experts from the World Health Organization and the Littoral Delegation of Public Health take samples of this water for further analysis in a laboratory. These after widespread suspicions that the running water is a root cause of the cholera epidemic in Jombe-Penja, Mongo Division, Littoral Region. Boile River remains one of the attraction sites in the area, assembling inhabitants for diverse activities, making it prone to the cholera epidemic. Today, the same area has been marked as a red zone, following the detection of scores of cholera cases. We are here to take samples of the water for further analysis in the laboratory. While waiting for the outcome of the research analysis, sensitization continue on the field. Council agents have embarked on a door-to-door strategy, educating the population on the dangers of the disease and techniques to render the water potable.
La propriété est la chose la plus meilleure pour éviter le choléra. Se laver les mains avant et après le repas.
Cholera cases have been detected in the town of Jombe-Penja, with 1/3 registered so far. The whole of the St. Mark Hospital has been transformed in a special ward for such cases. Medics say treatment, though remains costly, is free for patients. The hospitals are already running out of budget and equipment to properly treat the cholera cases in the Mongo division. Medics have cried out. We have quickly re-strategized in order to confront the disease. We had to recruit more personnel and simplify all procedure in order to treat patients free of charge. Some wards have been transformed into specialized wards for the treatment of cholera. It should be noted the littoral region alone for now counts over 60 deaths linked to cholera. Medics are calling on the population to stick to hygiene measures and to get the vaccines as a means of prevention.
Meanwhile, 43 persons have died in Limbe, the southwest region of Cameroon, as a result of the cholera outbreak, while almost 2,000 cases. The cholera epidemic is causing panic in hospitals that are already full to capacity. Ines Ondwambala completes that story.
Corridors, verandas, makeshift tents mounted in health facilities in the southwest region are invaded with cholera patients. Here we are at the Bota District Hospital in Limbe. Since the outbreak of the cholera epidemic, this hospital is receiving hundreds of cholera cases on a daily basis. The current situation is causing an atmosphere of panic across the region as the situation is added to the fragile health system of the region, posing as a real emergency. And cases of death. These as a result of poor hygienic condition, lack of potable water, and the absence of latrine as it...
Shit. Where people they can't hide shit. About this place where they can't hide shit for night, for daytime. If there's a shit for here for night, shit they want to go on our town shit. Now here they do shit.
During a crisis meeting, Southwest Governor Bena Ukalia Bilai gave Mayor firm instruction to construct toilets in Limbe.
An instruction I'm giving to the local authorities, the mayors and the SDO, is to undertake a program of construction of toilets here. In less than 30 days, they should construct public toilet. At the end, to oblige to everybody who is having a house here must show his toilet. But for the emergency situation, the council should build a minimum of 10 public toilets here.
Officials of Sonara and CDC equally expressed their willingness to provide water to the local population.
Kamwata have been invited to supply potable water in some quarter with the assistance of the municipality, the CDC, and the Sonara, who will provide tanks. So those are the measures we have put in place, and this to stop while waiting for a whole reorganization of the way of building and people living here in the city of Limbe.
Sensitization continues in the field as the population are called upon to respect basic hygiene rules to avoid the spread of cholera in the seaside resort city of Limbe.
We stay on health news to talk about tuberculosis, and recent statistics show that tuberculosis infections are on the rise, and Cameroon's Minister of Public Health has called on Cameroonians to be more vigilant as far as the drug is concerned. Manawa Malaki was speaking in Yaoundé on Wednesday ahead of the International Day for the Fight Against Tuberculosis this March 24. More in the following story with Unmu Kusumi.
According to 2021 statistics, 174 new cases per 100,000 inhabitants, with an absolute average value of 46,000 new cases is expected. Mortality around tuberculosis patients is 29 per 100,000 inhabitants. It is with the aim of fighting against this disease that the Minister of Public Health developed measures like the strengthening of screening around TPB, plus contact cases sworn positive, pulmonary tuberculosis, through the CETA project, free speed examination through users' freeze activities, and many others to mitigate the impact of COVID-19 pandemic on the fight against tuberculosis.
The COVID-19 pandemic not only weakened of our response strategy, but risked jeopardizing the progress made to end tuberculosis.
Health personnel actively in the field to fight against tuberculosis, but faced with challenges of coronavirus. Despite the difficulties, Manauda Malachi encouraged them to continue the fight.
I encourage all health professionals, civil societies, organizations, community actors who work tirelessly in the fight against tuberculosis. It is together that we will overcome this diseases in our country.
In line with the commemoration of the 29th edition of the World Tuberculosis Day, that the Minister of Public Health declaration called on Cameroonians to be vigilant toward the deadly disease as Cameroon joined international community this March 24 to observe World Tuberculosis Day under the theme Invest to End Tuberculosis, Save Lives.
And that report brings us to the end of this edition of the Primetime Newscast in the English language on Canal the International. Thank you so much for watching. We have news in the French language at exactly 19:50, 7:50 with Alain Gislain Kanga. But coming up next is the brief with Leo Piaget. As for me, I'll be back same time tomorrow. Good night.